Welcome back to the Healthy Sleep Revolution podcast. I am Dr. Meghna Dasani, and today we're diving into one of the more transformative areas in sleep medicine, how research into sleep disordered breathing is reshaping the way we think about health guidelines and public wellness. This episode is all about connecting the dots between the science of sleep and its ripple effect on our bodies, our healthcare systems, and society as a whole. So grab a cup of tea, settle in, and let's dive in. Let's explore why this research could change the way we live. Let's start with this. How often do you think about your breathing at night? Probably not much, right? After all, it's supposed to be automatic, and it just happens, right? But for millions of people, their nightly breathing patterns are anything but smooth. Sleep disordered breathing, or SDB, as we more fondly call it, disrupts this vital rhythm, setting off a domino effect that touches nearly every aspect of health. Here's the kicker, though. Many people with sleep disordered breathing don't even know they have it. They might write off symptoms such as constant fatigue, forgetfulness, or mood swings as just part of life, especially if it's children, right? But behind the scenes, their bodies are struggling to cope with repeated disruptions in oxygen flow and sleep cycles. Now, this isn't just a minor issue. It is a silent, or not so silent if you're a snorer, epidemic. And the research is showing us just how deep these effects run. Now, if you've been following the field of sleep medicine or are a regular listener to the show, you know that a lot of times we have been traditionally focused on symptom management, things like reducing snoring or improving daytime energy levels. But today, that research is evolving, and it is revealing something much bigger. Now, sleep disordered breathing doesn't just impact sleep. It disrupts the entire human body, all of the systems in the body. We're talking about cardiovascular health, metabolic function, and even your brain's ability to process information. Now, let's take insulin resistance, for example. Studies are showing that sleep disordered breathing can worsen insulin sensitivity, making it harder to manage your blood sugar levels. This is particularly important or concerning for people who are at risk for developing type 2 diabetes, or consider the link between sleep disordered breathing and heart health. We're now seeing such strong evidence of its connection to high blood pressure and stroke that some researchers are calling for mandatory sleep disordered breathing screenings for anyone with these conditions. Think about this for a second. What if your primary care doctor or cardiologist routinely screened for sleep disordered breathing? We'd catch so many cases earlier, wouldn't we? Potentially saving lives and reducing healthcare costs in the process. Now let's talk about how we actually identify sleep disordered breathing. Historically, diagnosing sleep disordered breathing required an overnight sleep study in the lab, which, let's be honest, it wasn't the most accessible option. But now we have solutions such as home sleep tests, wearable technology, and even AI are completely changing the game. There are smart devices that can track your sleep. They can detect irregularities in your breathing and even measure your blood oxygen levels. Now, is all of this diagnostic? No, but it is a great way of starting to screen, all from the comfort of your own home. And such tools make it even easier for people to take charge of their sleep health. Here's the thing, though. Technology alone isn't enough. We need to raise awareness, especially in groups that are often overlooked. Did you know that women are less likely to be diagnosed with sleep disordered breathing because their symptoms often look different? Instead of the classic snoring and choking and gasping for air, women could experience insomnia or chronic fatigue. And guess what we chalk it up to? Being busy moms, having too much on our plates, right? What about kids? Pediatric sleep disordered breathing is vastly underdiagnosed, even though we know it can affect everything from growth and learning to behavior. So if you are a parent or a healthcare provider, it's critical to know the signs in children as well. So then what's next? How will this research shape the way we approach health guidelines? The answer, I believe, lies in integration. Imagine a world where sleep disordered breathing screening is as routine as checking your blood pressure or your cholesterol levels or getting on the scale to assess where your BMI stands. Picture annual physicals that include a simple sleep questionnaire, or dentists working hand in hand with physicians to find potential airway issues. A lot of times, your mouth can be the first clue, and it doesn't stop there. Precision medicine, which is the idea of tailoring treatment to an individual's unique biology, is already making waves. In the future, genetic testing could help identify people who are at a higher risk for sleep disordered breathing long before their symptoms became apparent. At the population level, we could see changes in public policy, the stricter workplace guidelines and sleep regulations, or even urban planning strategies to reduce environmental noise pollution, which can worsen sleep disorders. This is the kind of forward thinking that could reshape not just individual health, but the health of entire communities. Why does this matter to society? Let's zoom out for just a moment. The benefits of addressing sleep disordered breathing go far, far beyond just better mornings or more restful nights. When people sleep better, they think better. They make better decisions and perform better. And when entire communities are prioritizing sleep health, this ripple effects touch everything: productivity, mental health, and even, believe it or not, economic growth. This isn't just about treating a condition anymore. It's about building a healthier, more resilient society. And this starts with taking sleep disordered breathing seriously, not just as a sleep problem, but as a public health problem. So as we wrap up today's episode, here's my challenge to you. Pay attention to your sleep, the sleep of your family. If you or someone you know struggles with snoring, fatigue, unexplained health issues, don't ignore it, please. Get curious. Talk to your doctor. Get second and third opinions. Talk to your dentist. Explore the resources and technology that is available to you. And for my fellow healthcare providers, let's push for better integration of sleep health into our practices. The science is clear, and the opportunity to make a difference has never been greater. Thank you for joining me on today's journey through the fascinating world of sleep disordered breathing. If this episode resonated with you, please share it, leave a review, or just reach out to me on social media. I love hearing from you. Let's keep this revolution going, one breath and one night at a time. Until next time, I'm Dr. Meghna Dasani, and this is the Healthy Sleep Revolution podcast. Sleep well, dream big, and take care, my friends.